Hello, and welcome to your proactive cardiovascular education. Proudly brought to you by CVED, screening for the risk factors to prevent heart attack, stroke, and sudden cardiac death. My name is Sean Zemla. I'm a certified holistic health coach and certified digital pulse wave analysis technician. We hope by the end of these modules that you'll understand more than 99% of people out there just what causes heart disease, so we can look at preventing unnecessary tragic cardiac events that usually end up in death, if not too soon after. In the 3 parts we're going to be going through, this is actually the first part and all the heavy lifting. It'll get easier from that point on. You'll get a firm grasp and thorough knowledge as to why we need to understand cardiovascular health, how to become more aware of your cardiovascular health, and what to consider for achieving optimal cardiovascular health through a holistic, whole foods approach, nutraceutical protocols, exercise, and stress reduction in hopes of preventing or even reversing the #1 killer in North America today as well as the world. In part 1, we're going to cover circulatory basic function, some of the physiology and anatomy to get familiar with your heart and your circulatory system, the cardiovascular disease risk factors, the markers that are checked when the doctors are pulling blood out of you to assess your heart, arterial health, and potential issues in your cardiovascular system, why foods, and in particular whole foods, that are clean, nutrient-dense, and medicinal are key to optimal health, and why regular exercise is necessary, and why targeted supplementation is ideal to prevent a tragic cardiac event such as a heart attack or stroke. Now, defining the topic doesn't have to be a complicated endeavor, but let's just start out by why the preventative is ideal. Of course, living in a reactionary-based healthcare system is not ideal, so we need to take a serious look at prevention as the only real viable solution to the #1 silent killer on the planet. That also happens to be an immense strain financially on the medical system. By empowering and educating the public in the importance of creating community through the value of early detection, not only can we do an invaluable service for our loved ones by helping them create a long, healthy, and enjoyable life, we can also relieve the medical system of a terrible and expensive burden. Cardiovascular, or CV, is simply a system involving the heart and blood vessels and your circulation. While health is actually homeostasis, or a balance struck by creating healthy habits, physically, mentally, and for lack of better words, spiritually, or how I'm fond of referring, the special connection we feel to life when we're able to be there fully for ourselves and our loved ones. Health is indeed our most priceless asset, and since we're pretty firm believers that our time here is the most valuable of currencies, how we spend it, how we invest it, and how we waste it, longevity is an honorable goal to seek and to attain, if not just for a quality of life, but for our families, what we can do for our communities, and the legacy we can leave behind from a life well lived with high character. The educational component of these modules have an elegant depth and can be come back to again and again, as well as shared to the people we care about. We're going to focus on the different types of food we need to obtain for necessary health and growth. This includes primary food, such as psychological nourishment and spiritual fulfillment. There are many types of cardiovascular disease. Some of the most common in the public mind are heart attack, stroke, sudden cardiac death, as well as congestive heart failure and congenital heart disease. So this problem is huge. It's a massive problem, and the 1.6 million Canadians living with it are the ones who are aware of it. It's a silent killer, and many, many more people are affected by heart disease that have absolutely no idea. It's a silent killer. 1 person every 7 minutes dies of heart disease. So call us, get your friends and family to call us, set up an appointment to be screened. It's absolutely critical that everyone gets screened at some point, if not regularly. Plaque in the arteries isn't the only problem to kill people. There's also the 21-year-old hockey player who drops dead unexpectedly that has nothing to do with plaque, obesity, and the like, and this affects 1,000 people per day. 350,000 people per year are hospitalized for heart disease, and it costs the Canadian economy alone $20.9 billion from medical services, hospital costs, lost wages, and decreased productivity. You're most likely to succumb to diseases related to your cardiovascular system than anything else. A silent killer, which is why we have created this preventative, convenient mobile service that's painless, quick, and affordable. We're building a solid network of naturopathic doctors, nutritionists, cardiologists, and physicians so we can help put an end to this absolutely tragic epidemic. You have a really hard-working body. It never rests, never ceases to keep things flowing. But just like we need to live our lives in high gear and remain perfectly calm, we need to treat this system with the respect that it deserves. Your blood takes about a minute to complete this circuit that plays out like a beautiful figure eight that goes to the heart, to the lung, to the heart, to the body, to the heart again. In fact, circulation is the key to everything. Blood flow through this majestic pump is meant to bring heat, hormones, nutrient, oxygen, and waste into and out of the body and organs. Without getting into too much of a crazy lesson on anatomy and physiology, let's take a look at the bronchioles or bronchioli. These are the passageways by which air passes through the nose or mouth to the alveoli, or the air sacs of the lungs, in which branches no longer contain cartilage or glands in their submucosa. They are branches of the bronchi and are part of the conducting zone of the respiratory system. The bronchioles divide further into smaller terminal bronchioles, which are still in the conducting zone, and these then divide into the smaller respiratory bronchioles, which mark the beginning of the respiratory region. The beast of a beautiful marvel of nature beats an unnerving and impressive 2.5 billion times in an average lifetime. And any mechanical engineer will tell you that stressed machinery will break down. So it's important to note that if that sucker is working too hard, it'll try beating 3 billion times and will most likely not even make it to 2. The heart's main concern is maintaining pressure. Blood pressure? Well, everybody's heard of blood pressure. This miracle of nature also creates its own electricity through specialized cardiac cells that utilize minerals that are classified as electrolytes. Now, a little primer on the heart in case you miss all those high school classes, but trust me, knowledge truly is power, especially when you can apply it to save your own life as well as others. First, we have the valves. Again, we have a pressurized system, so the valves open to let blood out and close to keep blood from coming back in. The pulmonary semilunar valve, you have the tricuspid valve, the aortic semilunar valve, and the mitral valve. So when you put your ear to someone's chest, you hear a lub-dub sound, that lub-dub, lub-dub. That lub is systole, which is ventricular contraction, and the dub is diastole, which is ventricular relaxation. So now you'll know when they're taking your blood pressure and they say the optimum is 120/80, you'll know exactly what they're referring to. The 120 is systole and the 80 is diastole. Now, cardiac cells are very specific to the heart. They actually generate their own electricity, which makes our heart its own electrical conduction system. Truly a marvel of nature. You see, our pacemaker cells generate their own action potentials. They do this because of the very leaky membranes present that work like clockwork, unless, of course, you have an arrhythmia or fibrillation, and that could lead to some pretty severe problems. The cardiac cells use electrolytes to regulate the beat of the heart and create that electricity. Calcium, magnesium, potassium, sodium, chlorine, and arginine play a crucial role in keeping you alive. These pacemaker cells we have, and everyone's heard of people with pacemakers that need to steer clear of the microwave, they ensure the cardiac muscle cell contracts in coordination with one another. You see, the brain has so much going on, it doesn't want to have to do everything for you. Magnesium also plays a role in the active transport of calcium and potassium ions across the cell membranes, a process that is important to nerve impulse conduction, muscle contraction, and normal heart rhythm. An adult body contains approximately 25 grams of magnesium, 50% to 60% present in the bones, and most of the rest is in the soft tissues. Less than 1% of total magnesium is in blood serum, and these levels are kept under tight control. Normal serum magnesium concentrations range between 0.75 and 0.95 millimoles. Hypomagnesemia is defined as a serum magnesium level less than 0.75 millimoles. Magnesium homeostasis is largely controlled by the kidney, which typically excretes about 120 milligrams of magnesium into the urine each day. Urinary excretion is reduced when magnesium status is low. Assessing magnesium status is difficult because most magnesium is inside cells or in bone. The most commonly used and readily available method for assessing magnesium status is measurement of serum magnesium concentration, even though serum levels have little correlation with total body magnesium levels or concentrations in specific tissues. Other methods for assessing magnesium status include measuring magnesium concentrations in erythrocytes, saliva, and urine. measuring ionized magnesium concentration in blood, plasma, or serum, and conducting a magnesium loading or tolerance test. No single method is considered satisfactory. Some experts, but not others, consider the tolerance test, in which urinary magnesium is measured after a parenteral infusion of a dose of magnesium, to be the best method to assess magnesium status in adults. To comprehensively evaluate magnesium status, both laboratory tests and clinical assessment might be required. So calcium is required for vascular contraction and vasodilation, muscle function, nerve transmission, intracellular signaling, and hormonal secretion. The less than 1% of total body calcium is needed to support these critical metabolic functions. Serum calcium is very tightly regulated and does not fluctuate with changes in dietary intakes. The body uses bone tissue as a reservoir for and a source of calcium to maintain constant concentrations of calcium in blood, muscle, and intercellular fluids. The remaining 90% of the body's calcium supply is stored in the bones and teeth, where it supports their structure and function. Bone itself undergoes continuous remodeling, with constant reabsorption and deposition of calcium into new bones. The balance between bone resorption and deposition changes with age. Bone formation exceeds resorption in periods of growth in children and adolescence, whereas in the early and middle adulthood, both processes are relatively equal. In aging adults, particularly among postmenopausal women, bone breakdown exceeds formation, resulting in bone loss that increases the risk of osteoporosis over time. So yes, your heart is an electrical conduction system, and it makes its own electricity. Basically, when we take a look at the example of how defibrillators work, it starts to make a little more sense. Now, people are normally under the common misconception that defibrillators work by jolting the heart and giving it electricity. Well, it's actually true, but at the same time, it's not juicing the heart, it's actually stopping the heart so that the leakiest membranes can start back up again first. So CPR, for example, simply forces a fibrillating heart to continue circulating oxygenated blood until the helper arrives, which would be a defibrillator. Now, if we take the analogy of a musical orchestra and you have the conductor on stage, he's the pacemaker. Now, if he has to go to the bathroom, then everybody starts to really, go out of tune and start doing their own thing. And then before you know it, you have absolute chaos, which is, of course, we call that a fibrillation. So when the heart is out of link to its perfect timing system. So the defibrillator will actually stop the heart so that the leakiest membranes in the sinoatrial node start up first. So we're actually resetting the heart when they're using a defibrillator, and a CPR is keeping the person alive until the defibrillators can get there. We have about 5 liters of blood at all times in our body, and our blood vessels, they're alive. Now, I'm sure most people are familiar with hearing about how impressive it would be to take your arteries and veins and to string them side by side. They would stretch over 100,000 kilometers. So, of course, going around the earth a couple of times. Now, the blood vessel functions to deliver oxygen and nutrients to cells, and they carry away waste products and take part in maintaining the blood pressure. So the arteries, basically we have 6 large arteries, and they are elastic, and they're not like pipes or like hoses. They also pump, and they move, and they vasodilate and constrict. So they're a lot like the heart in a sense. That circulatory system is always pumping, expanding, and contracting. So we want to keep those arteries nice and elastic and functioning properly and vasodilating and constricting, because there can be arterial stiffness due to plaque and of course arteriosclerosis, atherosclerosis. So your arteries are like balloons or pressure reservoirs. They expand and they recoil with every heartbeat so as not to burst or to leak. Now the venules, or those small little capillaries, they're really microscopic. So one of them could be the diameter of a hair, or 10 of them equal a hair. And their sole purpose is to exchange oxygen and nutrients to the cells for carbon dioxide and waste. They help regulate blood pressure. So something called thermal regulation is when the vessels tighten up, they force blood to bypass some of the capillaries, allowing less blood to be exposed and cold, therefore less heat lost. And the difference between veins and arteries is that arteries, they bring blood away from the heart, and they're depicted as red in the physiology and anatomy books. And the veins, they bring the blood back to the heart, so they are depicted in blue, making the rise of the misconception that your blood is blue when it doesn't have oxygen in it, which is completely false. It's just not as red as it would be if it has oxygen in it. And to sum up the cardiovascular system, the heart is really a pump. It's there to maintain pressure. It's like a super soaker. The lungs provide oxygen. The arteries are pressure reservoirs. And the arterioles control distribution. Capillaries are the exchange sites, and the veins are the blood reservoirs, at 1/12 the pressure of the arteries. There are a few determining factors that are completely uncontrollable when it comes to cardiovascular disease risk factors. Now, age, gender, race, and heredity do play a role in a lot of cases. So it's something to mention, but at the same time, we want to focus on what's controllable. And what's controllable is that 9 in 10 Canadians, 24 million, have at least one risk factor for heart disease or stroke. And these factors include eating less than 5 servings of vegetables and 1 serving of fruit per day, smoking, physical inactivity, overweight or obesity, high blood pressure, diabetes, and of course stress, which they're finding now is to be one of the biggest determining factors in aggravating heart attacks, strokes, and other cardiovascular events. So maintaining 5 or more healthy behaviors, not smoking, maintaining a healthy weight, regular physical activity, eating a healthy diet, and keeping high blood pressure, diabetes, and cholesterol levels in control is associated with an 88% reduction in the risk of death from heart disease or stroke. Blood pressure is actually a relatively simple concept. It's the pressure of liquid flowing through a pipe as a function of 2 variables, the rate of flow of the liquid and the diameter of the pipe. So to increase the pressure, you must pump more fluid to narrow the pipe. And of course, blood pressure and hypertension, well, you can see the numbers for yourself. That 175 over 105 has an 8 times greater risk of having something to do with cardiovascular disease. So blood pressure, in particular high blood pressure, is bad for every part of you. So blood flow and resistance are all tied together nicely. Blood flow equals the difference in pressure, resistance. Blood flow increases as pressure increases, but blood flow decreases as resistance increases. Anything that hinders blood flow or creates friction is absolutely not good for the circulatory system. Blood viscosity is usually constant. However, an excessive amount of red blood cells can thicken blood, just as very low red blood cell count, like anemia, can decrease viscosity. And of course, blood pressure can fluctuate because of emotional stress, physical exertion, dehydration, high sodium, and high fat. So high blood pressure is not the cause of heart disease. Instead, heart disease is the cause of high blood pressure. This is the truth. However, chronic high blood pressure, like hypertension, is a good indicator of the potentially serious damage to both the heart that creates the high pressure and to the blood vessels that have to withstand that extra pressure. So the heart has to work harder to overcome resistance. Sustained high blood pressure is going to equal a whole heap of trouble. Blood vessels have to take the extra pressure, and more muscle in the heart means more oxygen is needed. If it's atherosclerosis, and coronary arteries can starve the heart of nutrients and oxygen, that equals heart failure. If plaque causes a clot, heart cells starve, and a heart attack happens, which is a myocardial infarction. And you can see here the normal progression from a healthy artery all the way from endothelial dysfunction to unstable plaque formation, and of course, a clinical event that's bound to happen. Now, nobody wants to have a heart attack. So, they'll put you on blood pressure meds because high blood pressure is definitely the root cause of a lot of cardiovascular conditions. So what about the root cause? Before we get into diuretics and calcium channel blockers and beta blockers and alpha blockers and alpha beta blockers, we need to take a look at some of these root causes, like the markers for these heart disease in the first place, like cholesterol, homocysteine, C-reactive proteins, lipoprotein A, fibrinogen, and of course oxidative stress. Now, when we take a look at homocysteine is associated with damage due to the arteries, and one mechanism by which homocysteine is thought to cause this damage is by interfering with the way cells use oxygen, resulting in a buildup of damaging free radicals. oxidation triggers many diseases, including heart disease, strokes, cancers, and autoimmune diseases. Reactive chemical forms, such as free radicals, can oxidize low-density lipoproteins, producing oxycholesterols, and oxidize fats and proteins within developing arterial plaques. This oxidation injury, along with changes in nitric oxide metabolism, an important regulator and mediator of numerous processes in the nervous, immune, and cardiovascular systems, and decreased methylation, appears to contribute to the damage caused. Indeed, methylation defects and impaired DNA repair caused by disturbed folate metabolism are suggested to contribute to carcinogenesis. Homocysteine also stimulates the growth of smooth muscle cells, causing deposition of extracellular matrix and collagen, which causes a thickening and hardening of arterial walls. Overall, though, the exact mechanisms involved in the increased risk of ill health with raised homocysteine still remain a mystery in many respects, and more studies are needed to elucidate the exact associations. And talking about cholesterol, the actual truth about it is it's a small part of the cardiovascular disease risk. It does not clog your arteries unless it has something to attach to. A tear, inflammation, rough surface, a ridge, a sharp turn. The most important molecule in your body is cholesterol. It gives structure to every cell in your body. It's necessary for sex hormone production, needed for bile synthesis, and on and on. It's a health issue of the 21st century is this hypercholesterolemia, which is invented when a health professional learned how to measure cholesterol levels in blood. High cholesterol exhibits no outward signs, unlike diabetes or anemia, and normal blood analysis parameters changed over the years. Heart attack victims are automatically prescribed cholesterol-lowering medication even when they have very low cholesterol. And from Harvard, we learned that cholesterol is just guilty by association, and more than 60% of heart attack victims have normal cholesterol levels. The majority of people with high cholesterol never suffer heart attacks. Methylation, or detoxification of harmful substances, your body forms homocysteine in a digestive process when you eat food containing methionine, which is present in all animal and vegetable protein. Methionine is an amino acid suggested as a component of food protein and is found primarily in meats, eggs, dairy products, fish, chicken, seeds, nuts, and some vegetables. Methionine is activated to S-adenosylmethionine, which is SAM or SAM, by the enzyme methionine adenosyl transferase. Circulating levels of homocysteine are usually low due to its rapid metabolism via one of two pathways: a cobalamin, which is vitamin B12, and folate-dependent remethylation pathway that regenerates methionine, or pyridoxal 5-phosphate, which is vitamin B6, PLP. And that's a dependent transsulfuration pathway that converts homocysteine into cysteine. The standard American diet of processed foods are low in the helper B vitamins and deplete the body of B vitamins too. And this can accurately be determined in a blood test. Raising homocysteine levels can be caused by high alcohol consumption, 8+ cups of coffee per day, and it's generally higher in men than it is in women, or women after menopause. And seniors are at greater risk too. So B6 and B12 and folate nutrient deficiencies are also indicated in a cognitive decline. Data from large and respected trials and Nurses' Health Study and a Harvard Physician Study showed that daily supplementation of these three key B vitamins, so B6, B12, and folate, neutralizes high levels of homocysteine. As many as 80% of all the heart attacks occur when smaller plaques, destabilized by inflammation, rupture and attract a blood clot that blocks the flow of blood to the heart. The real culprit is inflammation in the arteries, not cholesterol. That's the one common factor. Inflammation is the body's frontline immunological response, but can turn from friend to foe. And many markers for inflammation have been studied, but the best are studied for cardiovascular disease. Produced by the liver in response to inflammation occurring in the body and when blood vessels are damaged. C-reactive protein levels in the body should be negative to very low, and men are at 3 times the risk factor for the heart attack because of it. And for women, it's the single most important predictor for a heart attack. There's a new study from the University of California Davis Medical Center that revealed that endothelial dysfunction occurs very early in the atherosclerosis process, and C-reactive protein plays a critical role in atherogenesis by inducing arterial wall damage. And this is a good reason to test for C-reactive protein every year. They have a high sensitivity test, the HSCRP. Other risks are macular degeneration, high blood pressure, type 2 diabetes, and osteoporosis. The lipoprotein A is a cholesterol particle causing inflammation of blood vessels. It's a low-density lipoprotein particle with an adhesive protein surrounding it, giving it sticky properties. And according to German physician Matthias Rath, lipoprotein A deposition in arterial walls causes inflammation because of its repair properties, but needs vitamin C. And vitamin C is what creates collagen in the body. So no vitamin C is the most dangerous risk factor for atherosclerosis. And unlike other components of your cholesterol count, the amount of LPA in the blood is not affected by habits, dietary or otherwise. It's hereditary, so check for the family. Fibrinogen is fibrin's inactive precursor. And it's several compounds that help to make blood clots. The most important is fibrin, made of stick proteins, fibers. The job is to stick to blood vessel walls, acting like a net to stop bleeding. Fibrin determines the viscosity of blood, so the thickness of blood through the entire circulatory system. It's considered an independent marker for heart disease. Fibrinogen levels can cause acute arterial blood clot that can lead to a sudden heart attack or stroke. The greatest risk of high levels are usually in smokers, people using birth control, postmenopausal women, and it can be a genetic trait as well. So we do need to take a second to talk about the real culprit here, which is oxidative stress. Free radicals are unstable electrically charged particles resulting from metabolic processes in your body, including dietary and environmental factors. They are extremely damaging to cell membranes, proteins, chromosomes, and DNA. Lipid peroxidation leads to a loss of membrane fluidity and impaired cellular function. Then there's advanced glycation end products. These AGEs are proteins or lipids exposed to sugar, and the glycation of LDL cholesterol promoting oxidation. And if free radicals are not contained, they damage everything through a chain reaction, producing other free radicals until arterial walls are no longer smooth and plaque is easily accumulated. So this brings us right back to exercise. And why is exercise important? Well, exercise raises good high-density lipoprotein cholesterol while lowering C-reactive proteins, gets your blood flowing and keeps your arteries and veins elastic and healthy. And as your metabolism rises, your liver will create more of the good HDL and clear away the bad LDL. The lower blood pressure by relaxing the muscles is extremely beneficial for your blood vessel walls, allowing them to expand. Induced sweating purges excess sodium. And why do we need to consider supplementation? Well, we need to bridge the gap between disease and health potential. These targeted nutrients are for identified symptoms, and we can ensure essential nutrients are being covered. And of course, we can get increased energy. It's not supposed to be a substitute for food, exercise, or stress reduction. Generally for chronic conditions or for prevention if the diet's lacking, and of course there's high anxiety in the lifestyle. Now, this is what's really truly important in terms of supplements. Not all of them are created equal in quality. So you need to find a capable health practitioner to help you find the right protocol. And never, ever stop taking your prescription drugs without the consent of your doctor. You need to consult your physician before taking supplements in conjunction with medication, and it's always a really good idea to get a naturopathic doctor involved with your traditional allopathic doctor. And we just need to remember the controllable risk factors here. There's malnutrition and high cholesterol, diabetes, stress, smoking, physical inactivity, overweight or obesity, and high blood pressure. These things can all be done just by shifting the mindset and really slowly chipping it away at developing some better habits. And it's up to you. You decide it. Maintaining 5 or more healthy behaviors is associated with 88% reduction in the risk of death from heart disease or from stroke. And that's the end of part 1. I know it was a lot to take in. So part 2 and part 3 are a lot less heavy lifting in terms of terminology. And we don't expect you guys to all memorize all this stuff. It's just really good to know the complexities behind the cardiovascular system. And in relation to that, the sensitivities and why heart disease cardiovascular disease remains to be the number one cause of death worldwide, and of course in North America. So thanks for tuning in, and we'll get on to the next.